So the coronary artery disease is the decreased blood flow due to the obstruction of the coronary artery by an atheromatous plaque, which will lead to the myocardial infarction, which is the myocardium which is receiving less oxygenated blood will get necrosed, infarcted and then necrosed, which is going to damage the heart muscle distal to the occlusion of the vessel. So coronary angiography. So coronary angiogram is a procedure that helps to diagnose the heart conditions. Of the coronary angiography, the most common type is to do cardiac catheterization, wherein the catheter is passed along the femorals and guided through the descending aorta up, passes through the ascending aorta, and from there it is seen entering into the right coronary artery first and then the left coronary artery, or either way, and seeing the course of its distribution, the coronary artery distribution. So as it enters into the ascending aorta, it enters via the left or right coronary artery, and then it injects the dye, which is opaque and is visible on the X-ray machine to detect the course of the blood vessels. And if any blockage is seen, then the further action for the treatment is planned. So if there is any blockage that is seen, then the coronary artery bypass graft, that is CABG, can be done. So the autografts of the patient are taken mainly from the internal mammary artery, which is also known as internal thoracic artery, which is a branch of the subclavian artery. So if the blockage is in the left side, usually for the left anterior interventricular artery, it is the left internal thoracic that is taken as a graft. So this left internal thoracic artery is bypassed and is anastomosed with the left anterior descending or the anterior interventricular artery beyond the blockage, so that the circulation distal to the blockage is restored via the subclavian, internal thoracic and into the anterior interventricular artery beyond the blockage. Or the autograft can be taken via the radial artery. So the radial artery can also be taken as a graft. So before taking the radial artery as a graft, it is very important to conduct the Allen's test. Go back to the upper limb to remember what Allen's test is. So it is to see the supply of the blood by radial and ulnar arteries in the palm. So before compromising the radial artery, the Allen's test has to be performed to see the flow of the blood by the ulnar artery so that the palm is not compromised with. And the other graft is the saphenous vein, which can also be taken as a graft, wherein the saphenous vein is outturned, so that, because we all know that saphenous vein has n number of valves all through. So the valves should not be present in the coronary arteries. Arteries do not have valves, right? So to take out the valves, it is outturned. The vessel is outturned where the interior of the vessel is outside. then that saphenous vein is attached to the ascending aorta and to the right coronary artery beyond the blockage, so that the blood flow beyond the obstruction is restored via the flow from the ascending aorta, then via the saphenous vein graft and to the distal part of the obstruction of that particular coronary vessel. And nowadays, not going through the CABG because it is an open procedure where the whole length of the sternum has to be severed and then it has to be wired later after the grafts. So here it is called stenting. So when there is a blockage that is noted via the cardiography, then it is the same procedure as it is seen with the cardiac catheterization. But here a balloon also is taken along with, and at the blockage, the balloon is inflated. You can see the atheromatous plaque being compressed. So there is inflation of the balloon, which after leaves the stent that it carries, so that the narrowed vessel becomes widened. So after the stent is kept in its place, the balloon is deflated and is taken off, leaving the stent in its place at the narrowed vessel. So this is what is a procedure that is called as stenting. There is another feature which is called as coronary steal syndrome. You all know the subclavian steal syndrome, where if there is a blockage of the subclavian artery, the blood supply to that particular limb is brought about by the vertebrals of that side. That is the subclavian steal syndrome. So here what happens is, in the coronary steal syndrome, so there is dilatation of the coronary arteries in the presence of coronary artery disease. That is, when there is blockage of the coronary arteries, the distal part of the coronary arteries do not have the same pressure to supply the blood to the myocardium distal to the blockage. So then what happens is, when there is hypoxia that is seen in the myocardium distal to the blockage, the cytokinins are secreted by the myocardial cells of the ischemic area, which stimulate the dilatation of the vessel distal to the blockage, and also the potential anastomosis that is being formed. So there is a redirection of blood flow from the heart muscle supplied by the blocked artery to the other regions of the heart, precipitating this aspect more. So that is what is the coronary steal syndrome. And this coronary steal syndrome can be evaluated by the stress test. And this can also be a potential for the CABG that is being done distal to the obstruction. So for example, if the internal thoracic artery is anastomosed to the anterior descending artery or the anterior interventricular artery beyond its obstruction, there can be a possibility that the blood from the distal part of the coronary artery, which is flushed by the epicardial arteries, because of the potential anastomosis, can be redirected back into the subclavian artery. So when there is the subclavian artery blockage also. So that has to be taken as a precaution when CABG is done. It has to be ruled out that there is no stenosis or the occlusion of the subclavian artery. This is what is called as coronary steal syndrome. So clinically, it is very important to know the difference between the heart attack and the cardiac arrest, which are totally different. So the cardiac arrest is because of the coronary artery disease, which causes the hypoxia or the loss of blood supply to the area of the heart beyond or distal to the obstruction because of the atheromatous plaque, which leads to myocardial infarction, and the person here in heart attack is conscious and the heart is beating. So the heart attack is the problem with the blood flow. Coming to the cardiac arrest. The cardiac arrest. So the cardiac arrest is the abnormality in the conduction of the heart where the heart stops beating abruptly. So the patient is unconscious and the heart is not beating. So this becomes a medical emergency where CPR has to be done as an immediate first aid, that is cardiopulmonary resuscitation. That has to be done, and then the patient has to be shifted to the hospital if in case he needs a defibrillator. So this is the main difference between the heart attack and the cardiac arrest, where the heart attack, the person is conscious and the heart is beating because there is sluggish flow of the blood and can be taken care by CABG or stenting, whereas cardiac arrest is basically by the non-functioning of the conducting system of the heart, where the heart stops beating abruptly, which needs a medical emergency and needs the basic life support, which is called as CPR, the cardiopulmonary resuscitation. So in a lighter vein, there is something like vena amoris, which means a vein of love. So in Greek, there is a traditional belief that the vein from the fourth finger, that is the ring finger of the left hand, directly goes to the heart. So there is a direct connection. That's how it is being believed by the Greek. And that is the reason the engagement ring or the wedding ring is worn on to the ring finger of the left hand. You can see anywhere. The ring finger of the right hand is not worn for the engagement ring. So that has become a habit, doesn't have any connection, but is a belief, age-old belief, which goes like this, just an information on a lighter side. So yeah, we have to keep our heart very safe by exercising daily, by eating balanced right food. And did you see these two? No smoking, no alcohol. with these, and if any problem, the medication has to be taken properly. By all these things done in a right way, the heart of ours will be healthy enough. So that's for the day.